Welcome to 41 Today Lifestyle, everyone. I'm Troy Thompson. Joining me in the studio today is Dr. Rodgers from Surgical Associates of Warner Robins. And today we're talking all about colon cancer because March is the month of awareness. Welcome to the show, my friend. Nice to see you again.
Thank you.
Colon Cancer Awareness Month, super important, right?
Yes, sir.
Okay. Why do we have an issue with men not wanting to come in and have a colonoscopy?
Well, it's not only just men. A lot of people don't like the idea of a colonoscopy. It's a long camera. It's about the size of a finger.
Yes.
But it's long. It's 5 or 6 feet long.
It seems intrusive.
It goes all the way around the colon, and it seems like it's going in a long way in a hole that's not that deep.
What are we looking for?
Really, we're looking for early cancers, which we can find, and it's a treatable cancer when we find them early. More importantly, ideally, we're looking for polyps, which will turn into a cancer.
Well, let's explain that to everyone at home, because when you say polyps, that scares people.
Right.
So can you have polyps and get rid of them whilst you're having the colonoscopy? And then do you send them off to be tested, or how does that work?
So yeah, that's actually the main reason we like to do colonoscopies in people that otherwise are doing fine and not having any issues. A polyp is a little nubbin of tissue. It looks kind of like a skin tag on the inside of the colon, and they tend to be precancerous. We know that all cancers in the colon start out as one of these little polyps.
Really?
So if we can keep you free of polyps, we can keep you free of cancer. So we find those polyps, we take them out, the pathologist looks at them, makes sure there's no cancer in there, and also gives us an idea of how aggressive a polyp that was, and as long as we keep that out, then that one can't turn into a cancer.
So we just want to share a little bit of fact that I found out in commercial break. You said to me African American race is more susceptible than what they are with the Caucasian race, and that their age of having to have a colonoscopy is lower. Why is that?
Well, African Americans are more likely to get polyps.
Right.
So if you're more likely to get polyps, you're more likely for those to turn into a cancer. So a polyp will take, depending on how aggressive it is, in general, it takes about 8 to 15 years for a polyp to turn into a cancer.
Oh.
So if you're getting them younger, we say start at 50 because about 20% of people have a polyp by the age of 50.
Right.
African Americans, about 20% of people will have a polyp by the age of 45.
Okay, so that's when you would be going in to have a checkup or a screening. Because they're two different things,
right? It's called a screening colonoscopy.
Right.
So as we do a colonoscopy, we look for polyps. If you don't have any polyps, you only have to do it every 10 years.
This is the perfect thing. Now, we want everyone to know that is colon cancer a death sentence?
It can be. It definitely can be if you let it go too long. The whole idea is if we find a polyp, we can get rid of it before it's even a cancer. If you do have a cancer, and we will find a cancer on occasion that nobody suspected and we didn't have any reason to think, we find a little cancer, and a little cancer in the colon that's early is curable with that's the cure for cancer, is finding it early.
What are you doing for treatment-wise when you find that?
When you find a colon cancer, you do need surgery. You need that part of your colon removed.
So nothing to be scared of if you take care of yourself, and it's all about prevention. Is diet and lifestyle, or is this truly a hereditary issue?
Well, hereditary is definitely a big component.
Right.
There are some studies that suggest being diabetic, smoking, and being overweight are also risk factors for developing colon cancer.
I got you. Well, thank you so much. We appreciate you, Dr. Rodgers. Thank you for coming in. Remember, everyone, if you want to find out more information, there it all is up on the screen. Surgical Associates of Warner Robins. Remember, everyone, March is Colon Cancer Awareness Month. Give your dad a nudge, give your brothers or your uncles a nudge, and make sure they're getting screened. Back after this short break.